Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
I like to start a series on frequently asked questions, and today one of the most frequently asked questions happens to be about saliva hormones. Well, first you should be aware that saliva hormones' advantage is that it demonstrates the free component. Several hormones, specifically like T3, T4, thyroid, they are bound. Cortisol, like cortisol, is bound mostly to plasma. Proteins like cortisol binding globulin and albumin. And pretty much for this exercise, sex hormones like testosterone and estrogen are typically bound to sex hormone binding globulin as well as albumin. Well, the issue is why you're getting some varying issues when you do saliva is often because of the collection technique. Please listen carefully because I'll teach you exactly how the collection needs to go, because you have to recognize that when you take saliva, we are measuring at Access Laboratories in the most minute and accurate way possible. The machinery measures in parts per billion. So you can imagine if any little bit of a bound component gets in, it's going to raise it. Well, how does a bound component get in? It does because if there's even a drop, I mean a microscopic drop of blood that gets into that particular sample, you're going to get an elevated, normal or elevated sample, which will help you clinically, no way, no how. So what I tell patients to do is to wash their mouth out with cool water about 15 minutes before the prescribed time to collect. Don't eat, don't floss, don't brush, don't do anything during that time. When it is time to collect, take that small tube out. Instead of trying to fill that tube in 5 minutes, tell your patients to take 20, 30, or even 40 minutes to fill it. It's tiny, but it looks like it can fill in a second. And yes, if they spit even one time and they have a gum disease, and by the way, 72% of the United States at any given time has either gingivitis or they have periodontitis, which means if a drip, microscopic, of blood gets in there, you have an inaccurate specimen to be the clinician to work on. So they should just well it up in their mouth. If they need to smell something like an apple lavender or something just to help that will help when they get the saliva welled in the mouth. Hold the cup to the side, and as the instructions now say, drool it. And then after 30 minutes when it's done, you know at that point you have an accurate specimen. If someone has acute dental disorder going on, or they've just been treated by the dentist, it would behoove you to wait for that specimen to be done by saliva. I hope this helps because I think it will eliminate a lot of questions. It's a frequently asked question. We'll do more of these as the weeks go on. Thank you so much for watching. If you have any further information or questions that you'd like, you can always write me at drmitch@mitchghen.com. That's DRMITCH at MITCHGHEN.com. Thanks again for watching.